This study is called trigger finger release in patients with and without diabetes. The background of this comes from the concept of the diabetic hand, in which patients with diabetes are more likely to have carpal tunnel disease, joint contractures, duplicitous contractures, as well as stenosing tenosynovitis, which is also known as trigger fingers. The trigger fingers disease process is thought to be slightly different in diabetics than it is in normal patients without diabetes, and they respond less favorably to A1 pulley injections and are more likely to need a surgical release of their A1 pulley. So for this study, we wanted to determine the prevalence and severity of PIP finger contractures in diabetics and non-diabetics, both before and after their surgical release of their A1 pulley. This is a prospective cohort study, which followed patients seen at the hand clinic at Good Samaritan Regional Medical Center. We wanted to record data both preoperatively at their PIP joint motion using a goniometer, and then following that at the 1 to 2 week post-op visit, as well as a 6 and 10 week visit if the contracture had not resolved by that time. So far, we have a complete data set at the 1 to 2 week post-op for 64 patients. Some of the demographics: 41% of the patients had either type 1 or type 2 diabetes. 2/3 had a single finger infected, while 1/3 had more than one finger infected. At the 1 to 2 week post-op visit, about 48% of the patients had not regained full extension post-operative. And down in figure 2, you can see that 62% of those were diabetics, while 39% were not diabetics. Similar numbers needed to go to therapy for motion at the 1 to 2 week visit. 34% without diabetes, 27% with. And as you can see, the last column of that figure there, all fingers at PIP angle of 0. When patients had more than one finger affected, they were included in this, and 50% of diabetics had all of their fingers at an angle of 0, while 63% of people who did not have diabetes did have all of their fingers back to 0, which would indicate no joint contracture post-operative. Back in figure 1, preoperatively, you can see their PIP angle in non-diabetics is more likely to be 0 than it is for diabetics across type 1, type 2, and a pooled data set. So for our conclusions here, we do not have a full data set, so this is a preliminary analysis and is currently ongoing. But currently there's a trend towards more likely to have a PIP joint contracture preoperatively as well as postoperatively for diabetic patients. Once we get a more full data set and we're able to have a higher number of patients, we'll be able to make more concrete conclusions. The future implications of this sort of study would be to establish, one, if diabetic patients might benefit from an earlier aggressive finger motion therapy program, as opposed to waiting to check their motion afterwards, versus a more extensive index surgical procedure, which would potentially include joint contracture releases or partial palmar fasciectomies for undiagnosed duplicitous contractures or other such hand maladies. Thank you.